So good morning. So I'm gonna perform an air clearance device. So before going to the patient's room, make sure we check the patient's chart. So once we're going to go inside, make sure we sanitize or wash our hands, and we always have to introduce ourselves to the patient and explain to them, such as good morning. So this is my name, by the way, is Anthony from the respiratory care department. So this one is an airway clearance device. This is what we call a capella. So I noticed you just came from a nebulization treatment. So this one would aid you in coughing, remove any secretions, clear up your airways, and also prevent your lungs from any collapse. So with this, make sure that patient would be able to understand well. Make sure we demonstrate it in front of them. And then before that, we always have to check the patient's ID band for confirmatory purposes. We position the patient in an upright position with their elbows like this, resting on a table. And then we also have to obtain vital signs and do our patient assessment. So when holding this, make sure they hold it like this. They should not block the flutter valve because it might do any problems with it. And then with the resistance, we set it in the first or the lowest setting, the negative side. So initially we start it like that. And then with using a mouthpiece, let the patient take a tight seal with their tongue underneath. And then make sure we also have a mask in place just in case the patient could not tolerate the mouthpiece. So when doing this, make sure the patient take a slow deep inspiration, and then they should not do a forceful cough but a strong exhalation only. So with a strong exhalation, they will notice any resistance. It's because of the flutter valve. So when they sense it, they should continue blowing it up because that would aid them in coughing. So ideally, we start it by about 3 to 5 times trials, and then every attempt, make sure we let the patient rest for a few seconds and allow them to cough. And then we should also not do more than 5 times to avoid any complications. And then when letting the patient cough, take note of the color, consistency, and amount. And also we should have a basin in place where they should expectorate, and also a cup so that we can obtain any specimen. And then when letting this use to the patient, ideally we can also let them use it every hour so that we can ensure they have a strong cough reflex, and they should not use it in synchronized or together with a nebulization treatment, because this flutter valve would lead to clumping due to the particles of the medicine. And then they should not soak it also in water. Instead, they should put it in this plastic container or plastic bag, and then with its name of the patient and its details, and then the mouthpiece, they can clean it with sterile water and allow it air dry. So after that, reposition the patient. Make sure we do another set of vital signs post assessment, and then once everything is done, make sure we remove the PPE that we wear, such as gloves, and then make sure we sanitize or wash our hands upon going outside. Once outside, chart everything that we note to the patient, and then make sure we communicate with the staff in charge or the nurse, or even if the physician is present.